Hey everybody, welcome to Professor Long's Lectures in Anatomy and Physiology. I'm Professor Bob Long. Today we're going to be continuing our bone studies in laboratory. We have a couple of human pelvi here, pelvises. Anyway, one side is a male pelvis, the other one is a female pelvis, and sometimes we can tell the difference when we find them based on how the bones orient. Now, this represents mostly the pelvic girdle. This is going to be part of our vertebral column called the sacrum, and part of the coccyx, although a couple of the bones have fallen off here, and you can see that on both sides. Now, I'm showing you this for a couple of reasons. Number one, there are several bones here. There's two bones here that make up part of our pelvic girdle. This is part of the vertebral column called the sacrum, and it's several vertebrae fused together. And then we have the coccyx or tailbone. We're going to learn those in a separate video. But each one of these bones is called an os coxa, C-O-X-A. Os meaning bone from osteo, and coxa for coxal bones. So we can say it two ways. So look, I have the individual ones here. These are real bones, these are plastic. But this is called a coxal bone. I have a single coxal bone here, and I have two os coxae which make up the pelvic girdle. Okay? Now, I'm going to go over the os coxae with you in a second, but one of the things I wanted to show you is this. When we find ancient remains, or if you find the bones of a human and there's no flesh to help identify, one of the things that you can do is identify if it's male or female. Now, I know we're in a non-binary society and all of that, but nonetheless, there's a lot that is determined by our genetics, which determine our sex or our gender, male or female. And even if we undergo surgeries and all the other hormonal treatments and everything, biochemically, physiologically, your body is still fighting its original designation genetically. And for example, even if a male is having surgery to be transgender, to become a female, we have to shut off the production of testosterone and induce the production of female hormones like estrogen and progesterone. And that individual would still have a higher susceptibility to breast cancer, even if they have the breasts removed. Well, not if they had them removed, but if you still maintain the breast tissue, you would have a higher risk of breast cancer than if you were male. But the male would still be able to have a risk of prostate cancer if the prostate is not removed. So despite the fact that, some people might get upset if we talk about this whole gender identity thing, we can still tell if someone was male or female simply by looking at the bones. For example, this is where the baby would pass in the birth canal. And on a male, when I put the bones together, if I look, it's kind of hard to see, but right here, it's a very sharp V, where over here, it's a much larger U-shaped structure, okay? So we can look down inside of here also and see that the birth canal, I can see there's more of a hard V right here, and on this side there's more of a U-shaped. And you can see that the hips are actually physically wider. These two bones are relatively the same size on an individual. But if I look carefully, the birth canal is much more narrow here. It's much larger there for a baby to pass through. And the hips have spread on a female. They're more angled inward here and more rounded, and it's a lot more open, and the hips have spread. When females hit puberty, some of the female sex hormones will target this joint, loosen the connective tissue at what we call the pubic symphysis, and at the sacroiliac joint, the joint between the sacrum and the iliac bones, and the hips will widen a little bit, causing some low back pain. They also widen even more during pregnancy, which causes a lot of females to experience that low back pain during pregnancy. All right, so I wanted to show you the differences and how they fit together. And now we're going to actually go over the individual bones. So I have two os coxae here. They would fit together to form a single pelvic girdle. I'm going to focus on the right side of the body, but you could learn the left side, and people get confused because they're like, well, on this one it's on this side, but on this one it's on the other side. You're going to have to learn both sides, okay? Learn them both. At some point, you should be able to tell if you're looking at the right one or the left one. That's important to do. You can't just study the right side and say, hey, Mr. Long, can you only ask me the right side, not the left side? Because when you're practicing as a nurse or a radiology tech, you can't say, hey, hold on, let me go get the left-handed radiology tech because I only studied the right side. You have to be able to tell both sides and know which side you're looking at. So this is an os coxa. Each coxal bone is made up of 3 other bones that fuse together somewhere around this cup. All of this upper bone, and there's a suture line that runs across here. It's a little bit difficult to see. It's going to run right through here. You're not going to be able to see it, but this is all called the iliac bone, or you could say ilium. The iliac bone, or ilium, is your hip bone. Now, if I look around this little cup, there's some lines that run through here, and there's actually some suture lines all along this bone that divides this into 2 bones here. And those 2 bones will fuse together, making this big opening or foramen. If I look at them, one of them has a very flat spot, and that's actually where these 2 bones fit together. Sym, S-Y-M, means with, and physis means to interact, like physiology. So that's called the pubic symphysis, where the 2 pubic bones fit together. And there's actually a cartilage pad that fits in there made out of fibrocartilage called the pubic symphysis. So that flat spot is where we've determined that this is the pubic bone. If I rotate this on the back side, we're kind of flat in the front and round in the back. This rounded part would be called the ischium, I-S-C-H-I-U-M, also called the ischial bone. So ilium or iliac bone, ischium or ischial bone, and pubis or pubic bone. Ilium, ischium, pubis. Ilium, ischium, pubis. And there's a big C-shaped structure that also tells you this is the ischium. This is posterior. This is anterior. Now, there's a large cup that's only on one side of the bone, and that's where the head of the femur is going to make your leg joint, your hip joint, I should say. That cup is called the acetabulum, or some people pronounce it acetabulum. Okay? It looks like the word acetabulum altogether. Acetabulum. Now, acetabulum means vinegar cup. Acetic acid is vinegar. And you could drink out of that, I guess, if you really wanted to be like a warrior in victory, drinking out of the skull of your conquered enemy. Anyway, I actually have the left one. Let me get the correct one here. Okay. Sorry for bouncing in and out. By the way, if you're following along, we are somewhere around page 21. We're at the bottom of page 21 studying the os coxae. Okay. Your femur bone would fit in here like this, and so this has to be lateral. If I know this is anterior, this C is posterior, the ischium is your bum, your backside, then this is lateral, then I can tell this must be the right hip bone, this must be the left hip bone, because that's lateral. Pubis is anterior, the ischium and the C is posterior. Okay? My lab partner and I used to say, see my bum, it's the ischium. So, ilium, ischium, pubis, acetabulum. Now, if I can find the acetabulum and I point it away from me, then I'm going to see the rest of the landmarks that I need to see on these 2 bones, or these 3 bones, I should say. So the top edge or ridge is called a crest. A crest is a ridge, and so that's called the iliac crest. Now, if I run my finger over the iliac crest off the backside posteriorly, it falls in this large C-shaped groove. That's where there's some nerves and some tissue that run here, and one of the nerves that runs through here is called the sciatic nerve. So we call this the greater sciatic notch. Okay? Pick 4 or 5 structures and practice that. Ilium, ischium, pubis is flat. That's the acetabulum. If I make the acetabulum go away, I have the iliac crest, the greater sciatic notch. Now watch. If I make a little toy gun, don't do that in elementary school, they'll suspend you. But if I stick my finger in here, my thumb lands on this ear-shaped or thumbprint-shaped structure. That technically is called the auricular surface. Auricle, A-U-R-I-C-L-E, means ear, and it's the shape of an ear. So that's called the auricular surface. And the sacrum would make a joint here called the sacroiliac joint. As a matter of fact, I'm sorry to bounce around, but if I stick this pipe cleaner in here, it's running through the sacroiliac joint between the sacrum and the iliac bone. And that's where the sacrum actually sits, is on that auricular surface. So, quick review. The entire bone is called the os coxa or coxal bone. ID the bone, ilium. ID the bone, the round one is the ischium. ID the bone, the flat one is the pubis. ID the cup or space, acetabulum. ID the ridge or edge or part of the bone, iliac crest. ID the big C-shaped groove, greater sciatic notch. And ID this rough spot right here, or this ear-shaped or flat-shaped structure, that is called the auricular surface of the sacroiliac joint. Okay. Now, if I run my finger out of this, this is actually called the ischial spine. It's not on our list, but you could learn it. If I run past the ischial spine, there's a little groove here called the lesser sciatic notch. I have the greater sciatic notch, the lesser sciatic notch. That's called the ischial spine. Now, just below the lesser sciatic notch, if I look at the ischium bone, there's a large rough spot here where a lot of your buttocks muscles can attach and some other muscles and tendons and ligaments attach. That rough spot on the ischium is called the ischial tuberosity. Okay? Greater sciatic notch, lesser sciatic notch, ischial tuberosity. If I ask you for the bone, it's the ischium. If I ask you for the rough spot on the bone, that would be called the ischial tuberosity. Okay? So there's a lot going on this bone. If I'm on the ischial tuberosity, all the way over here, the flat spot where the pubis is called the pubic symphysis. That flat spot is the pubic symphysis. Okay? Finally, the last thing you need to know is called the obturator foramen. The obturator foramen is the big obvious hole. Okay? That's called the obturator foramen. Now, I've moved it around a lot, so let's try to do this more simply. Okay? Coxal bone, ilium, ischium is round, pubis is flat. The bone is the ischium, the bone is the pubis. The cup is called the acetabulum. Make it go away. Iliac crest, greater sciatic notch, sacroiliac joint or auricular surface. Okay? Lesser sciatic notch, ischial tuberosity, pubic symphysis, obturator foramen. Iliac crest, greater sciatic notch, auricular surface. The lesser sciatic notch, the ischial tuberosity, the pubic symphysis, and the obturator foramen. It's probably the most difficult one you're going to learn in this video, so practice it till you cannot stand it. Do it till you understand it. Do it till you can teach it to someone else, and then do it 5 more times, just to make sure. Okay? So now, the next bone that's on the list is called the femur. I have the right femur here. The proximal end of the femur has this nice rounded head and a skinny little neck. The distal end of the femur has all these knots on it. Now from an anterior view, it's not super remarkable. There's not a lot to see. But if I turn it over, just below the neck, there's 2 large bumps that stick out here that are called trochanters. It's spelled with a CH, but it's pronounced like a K. Trochanters. There's a hard ridge or line running down the backside. And then I have 2 big knots down here called condyles. So I like to learn the femur from the posterior view. Okay? So, let me see how high my picture gets. I'm sorry to do this to y'all. Yeah, let me back off a little bit on my zooming in stuff here. Okay, I'm going to move my camera. Please bear with me. All right, now you can see the entire femur. Okay, so from an anterior view, I have the head and the neck, and this big knot is called the greater trochanter. I like to study it from behind. These 2 big knots are called condyles. And there's 2 little bumps called epicondyles, just like on our humerus, only they're not on our list of things to know. Nonetheless, if I stand this up like this and I flip it over, I can see these bumps sticking out here a little bit better. So this structure is called the head. This is called the neck. This is called the greater trochanter. And this bump is called the lesser trochanter. Greater trochanter, lesser trochanter. Just practice those 4. Head, neck, greater trochanter, lesser trochanter. Head, neck, greater trochanter, lesser trochanter. And you need to practice spelling these. Now, This little line running down the backside here is where a bunch of muscles attach. That's called the linea aspera. Linea aspera. If I go down here, since the head always has to point medially, this knot is the medial condyle. This knot is the lateral condyle. And between those is what we call the intercondylar groove. And if I flip it over, the patella or kneecap is going to ride right here. So that is called the patellar groove or the patellar surface. Okay. So, quick run through from behind. Head, neck, greater trochanter, lesser trochanter. Linea aspera, medial condyle, lateral condyle, intercondylar groove or fossa, patellar groove or fossa. So, let me look at your list and see how we have it written. Well, however it's written is how you need to learn it. Now, let's move on to the patella. I have two patellae here, or kneecaps, okay? And when we look at the patella has a little flat spot and it has a little point. The point is inferior, the flat spot is superior. The point points down at your toes if you grab your kneecap, okay? Now, if I hold it this way, I notice that it's flat on one side, but it's got this bump or mound on the other side, and it's very smooth there. The cartilage that would be there would allow it to ride in the patellar groove or on the patellar surface of the femur. So when you're bending your knee, the patella rides in that groove. By the way, if it pops out of that groove, which happens a lot more in people who are super flexible, usually young female athletes, they get a lot of knee pain because their kneecap rubs. So you have to stabilize the patella with some tape or a patellar stabilizer and brace. So those little knee patent braces with the hole cut out. Anyway, so now, if I look at this, the flat spot is called the base, the tip is called the apex. Base and apex. Now when I flip it over, these are called articular surfaces or articular facets. A facet means a little face. Each articular facet is going to articulate with the patellar groove. Now you can tell which one is medial and which one is lateral. If I lay it on the articular facets, no matter what I do, it tends to lay on the lateral. The lateral facet is much larger. The medial facet is a little bit smaller in surface area, okay? So if you're ever on a stroll with your loved one and you find a pile of bones in a park or something, or on a trail, or you find a human kneecap, you can impress them by saying, oh look, there's the base and the apex. That's the medial facet, that's the lateral facet, because it lays on the lateral facet. You can also tell if you have the right kneecap or the left kneecap. So if you lay them on their facets with the apex pointed away from you, they always lay on the lateral, and whichever direction they lean tells you if it's the right one or the left patella. Again, you have to point the apex away, let them fall on the facets, it lays on the lateral, and that would be left and that would be right. Anyway, here's what you need to know. ID the flat spot, ID the point, base and apex, ID the bone, patella, ID the surface or ID the surface, medial and lateral facets or articular facets. Alrighty? Now, we only have a couple of more bones to do, and there's not a lot on these two bones that we're going to learn. One of those lower leg bones is called the tibia, okay? And I actually have the left one. Let me do, I had the right one. This is the right tibia, okay? You have, when we study the arm, when we study the arm, we have one upper arm bone and two lower arm bones, the humerus, the radius, and the ulna. Well, the leg is set up very similarly. We have one upper leg bone called the femur. We have two lower leg bones called the tibia and the fibula. Now, do not make the mistake of confusing them. People will combine the names and say tibula and fibia. Please don't do that. The bigger of the two bones is called the tibia, and the smaller of the two bones is called the fibula. You see how smooth that was? Not everyone can do that like I did. But This is the tibia, the larger of the two. This is the fibula. The fibula has an L in it for being literal and lateral. It's the lateral of the two bones of your lower leg. The tibia makes up your shin. The proximal end of the tibia has these two flat spots and these big knots that stick off. The flat spots on top are called the tibial plateau. Plata means plate or flat, so that's the tibial plateau. The two knots sticking off are called condyles. One of these is a medial condyle, the other one is a lateral condyle. How do you tell? Well, I like to look at the distal end of the tibia, and when I put the fibula with it, I have two condyles here. Two, what are called a malleolus or malleolus. One is called the medial malleolus or medial malleolus, which is on the tibia. The fibula has the lateral malleolus. If you reach down and grab your ankle, the knot on the inside and the outside of your ankle. The medial malleolus, the lateral malleolus. I'm going to set the fibula down. If I know this is the medial malleolus, this knot sticking down right here, then if I go straight up, that has to be the medial condyle. That's how you get oriented. This other knot sticking off would be called the lateral condyle. And this little knot right here on the front is called the tibial tuberosity. So there's four structures you need to know besides knowing the bone. The bone is the tibia, medial malleolus, medial condyle, lateral condyle, tibial tuberosity. That's it. If I study now there's more structures, we're not going to learn them. If I study the fibula, the two ends of the fibula, one is rather shorter and broader, the other one is more narrow and wide, almost like an arrow if you were going to shoot it. The shorter and broader one is called the head of the fibula, and it's the proximal end. The distal end of the fibula is more like an arrowhead, it's more pointy, and that is called the lateral malleolus. So there's three things you should know, and really only two, because there's only two on the list for now. Fibula, lateral malleolus. Okay? Now, we're done with the lower extremity. We've already done the hands and feet. The very last thing we're going to do is going to be the thoracic cage with the sternum and the vertebrae, and we'll do that in another video. I hope you had as much fun as I did. I hope you learned something. I hope you do this till you can't stand it. Do it till you understand it. Then do it 5 more times so you can make your A. There's a lot of bones to learn. You better start somewhere. Okay? See you in the next video.